Step 1. Your consultation. Your first step to getting an FUE hair transplant is your consultation. Your consultation may initially take place with one of our patient advisors, who are very experienced in the procedure and can answer many of your questions. You will need to have a consultation with one of our hair transplant surgeons before being able to book your procedure. This gives you the chance to firstly meet with the surgeon, discuss your hair loss, and go through your medical history before they are able to analyze your hair and assess your suitability for a hair transplant. It is important that your hair follicles are the strongest they can be to ensure a successful hair transplant, so your surgeon may suggest a course of medication ahead of your surgery. Step 2. Preparing the scalp. As your procedure day approaches, you will be required to shave your hair. Some patients choose to this gradually in the months leading up to their procedure date, but others may wait until the day and have this done in clinic. Having a shaved head allows your hair transplant surgeon to mimic the natural angle and direction of native hairs and minimize transaction rates. However, in some cases it is possible to perform a partially shaven or unshaven hair transplant, and this can be discussed and decided in your consultation. Step 3. Pre-checks. Arriving at the clinic for your hair transplant, you will be required to fill in some paperwork consenting to the procedure, and this will all be explained to you by the nurses assisting the procedure at the clinic. You will also have your preoperative photographs taken, which will be held by the clinic. Your surgeon will then run through the procedure steps again with you and answer any questions that you have. Step 4. Anesthetic. Before your procedure starts, you will have local anesthetic injected into the scalp in order to make the extraction and grafting of the hair painless and comfortable for the patient. This part may sting initially, but many patients are surprised about how quick it takes, and it will take effect almost instantly. You will be conscious during the entire procedure, so if at any time you are feeling uncomfortable or want to take a break, you will be able to communicate this. Step 5. Extraction of follicular units. An FUE hair transplant procedure starts with the extraction, which involves using a specialized punch device, ranging in diameter from 0.6 mm, 0.9 mm to puncture the skin around the follicle 1 to 2 mm from the surface, and the hair follicle bulb is then removed using fine forceps with the aid of a powerful magnifying glass to ensure precision. Once the hair follicle bulb has been removed, it is then placed into a glass tray and kept in a solution to keep them at a perfect range of hydration, temperature, and humidity until the extraction process is complete. Step 6. Harvesting the grafts. Once the extraction process is complete, then you are usually given a break for lunch, where you will be given the chance to stretch your legs and have something to eat. The clinic will provide patients with lunch, snacks and drinks throughout the procedure, so do let the team know of any dietary preferences ahead of the procedure. During this time, your surgeon will be starting to examine the extracted grafts and make a selection into which ones are suitable for use and which are not. They are then separated into groups by thickness, size of the bulb, and number of hairs to make sure that there is enough variation to provide the patient the most natural-looking result. Step 7. Implantation of the grafts. Once your surgeon and their team have selected all the grafts, you will then be ready for the implantation stage of the FUE hair transplant procedure. You may need to have your local anesthetic topped up at this stage to ensure that the procedure is still pain-free and comfortable. Each follicle is then manually implanted into the recipient area of the scalp by your hair transplant surgeon. The implanter tool will firstly penetrate the skin before the hair follicle bulb is then placed 1 mm below the surface in the intradermal layer of the scalp. The number of hair grafts being inserted will vary between each patient, and in large cases this stage of the procedure may take place over 2 days.